Well, President-elect Donald Trump announcing two other major cabinet nominations today. Trump tapping House Budget Committee Chairman and former surgeon Tom Price to run the Health and Human Services Department, and Elaine Chao for Secretary of Transportation. Of course, you remember Chao served as Labor Secretary in George W. Bush's administration, and she is married to Senate Majority Leader Mitch McConnell. Now, if confirmed by the Senate, Trump will have to turn to these two D.C. insiders to deliver on two of his biggest campaign promises: infrastructure and repealing and replacing Obamacare. Joining me now to discuss, Betsy Woodruff, Liz Peek, and Brian Brenberg. Liz, let me start with you. I like the Elaine Chao. I think the Elaine Chao pick is very compelling in the sense that she's an establishment person. No one can dispute that. Yep. She worked with both Bushes. Her husband is pretty well known in Washington, D.C., and yet she has the skill sets and the contacts probably to get this infrastructure project out the gate faster than anybody else. Yeah,
you know, with all the drama about Secretary of State, the truth is this is one of the most important appointments, as is Price for HHS, that Trump is going to make, because these two initiatives are probably the most popular things amongst the American people. A poll out today shows that 78% of voters, registered voters, expect him to follow through on the infrastructure issue. And Trump is, above all else, going to be judged by what he actually gets done. No one's going to care who does it. So Elaine Chao, I totally agree with you. She's been in this department before. It's not just that she has an incredible bio. She actually was Deputy Secretary of Transportation, knows where all the bodies are buried, knows how to get stuff done in Congress. Look, it's going to work, and I think she is a terrific choice.
You know, Betsy, for all of the hand-wringing over Mitt Romney, I heard no one get upset about you know, these two choices. Of course, you have with Price, someone who actually put forth a bill. You know, it's not just sort of rhetoric about, hey, repeal and replace. A lot of people can say that. We've got someone, a former physician, a surgeon, who understands how the system works from both sides of the equation.
Right, exactly. Tom Price is not going to be a controversial pick at all among Republicans, in part because of what you said, that he's actually had the guts to put forward a plausible replacement for the Affordable Care Act, but also because he has great relationships on Capitol Hill with his House colleagues. On top of that, though, he's not just a D.C. insider. He was also a founding member of the Congressional Tea Party caucus. He was a fixture at many of the early Tea Party rallies back in 2010. He's been going after the Affordable Care Act ever since its inception, and he has a ton of credibility with the Tea Party. His office has done a ton to reach out to conservative bloggers, conservative social media types. They've really bent over backwards to make sure that he can sort of have one foot in the establishment camp and another foot in the movement conservative camp. And now we see it paying off for him, as it looks like he'll be able to get through Senate confirmation without any sort of opposition from conservatives.
Brian, it's going to be interesting. Betsy mentioned the Tea Party. It feels like fiscal conservatism is out the window, though, right? I mean, listen, $1,000, let's fix this infrastructure stuff up. And with respect to Obamacare, it's going to be a little bit tricky if you keep those two key components, young adults staying on and pre-existing conditions. Those are two of your major issues. To make it work and keep those in place, not an easy thing to do.
Yeah, you know, people who look at what Ryan's talking about, what Trump's talking about, keeping these provisions, are saying, okay, you're going to have to make up for the cost somewhere else. That probably means that older individuals are going to have to pay more for their premiums than they're paying right now under Obamacare. That's not going to be popular with those individuals. So there's going to be some trade-offs here. The more you want to keep of Obamacare, the less you're going to be able to do in terms of moving this to a real free market type healthcare system.
You know, also, of course, and it's really tricky, you got coal miners with black lung who actually are on Obamacare, so it's not the easiest thing to take apart and put back together. It's like changing the tires on a moving truck, Mack truck, if you will, Liz.
But they're trying to figure out basically how to finance the two popular aspects of Obamacare that he has said he'll keep, and the most difficult of those is the pre-existing conditions one. So they have some good ideas. That the high-risk pool is addressing that issue, et cetera. Look, they have to do this. They're going to have to repeal and replace Obamacare. The good news about this fellow is he has offered up 100 bills about how to do exactly that, and he's incorporating some of the free market solutions, such as competing across state lines for insurers, that everybody thinks is a good idea. No one can figure out why it didn't happen in the first place. So I think these are good choices.
He's going to work very well with Paul Ryan, and that's really important.
Yeah, very important.
It is important. And out there somewhere in a free market solution is the Walmart of health insurance.
That's what I've talked about.
Just let it evolve.
I agree.
It'll happen. It'll happen.
I agree with you.
Yeah. Thanks a lot, guys.